Medical Tactile Incorporated presents a clinical training video for the SureTouch system narrated by Dr. Carrie Kaufman. The use of these videos is strictly for demonstration of and the clinical training on the SureTouch visual mapping system by Medical Tactile Incorporated. The use or reproduction of these videos for any other purpose is expressly prohibited without the approval of Medical Tactile. Patient number 5 is a female patient undergoing a focus examination of her right breast. This patient has a suspicious mass in her right breast in the inner upper quadrant at the position of the number 1 marker. And this is an excellent depiction of how to use several SureTouch scans to assess a mass and the proper scanning technique to go over a large mass to get an accurate finding. So let's listen to Dr. Kaufman as he explains this procedure.
It turns out that she has 4 exams. I've looked at these exams already, and I'd like to talk to you about the 3rd exam. Now note that all 4 of these exams, named 1.1, 1.2, 1.3, and 1.4, all examined the same exact area. And these are directed exams. So we're looking at one particular spot. And so I find it helpful to look at the same spot several times, because sometimes you're not holding the transducer exactly right, sometimes you don't get the best picture of the mass, and by doing more than one exam you can tell yourself which exam is the best. It turns out that in my opinion, after looking at these exams, 1.3 is the most representative exam of the mass. So let's first just watch this exam and watch the whole thing, and then we'll comment on it. Perhaps comment on it during it as well. As we go over one spot, we note that there certainly is a mass. There's a dominant mass, and the examiner keeps the mass in field, in view through the entire exam. It is not going out of view. And by doing that, it's much more likely to get a good accumulated image on the right by keeping your exam target within the mesh screen. So let's look at that again. Here, the examiner is looking at this mass, and note there seems to be 2 peaks. It's a big mass, it's consistent, but sometimes one peak is higher and sometimes the other peak is higher. Why would that be? Are there really 2 peaks? Is one getting higher or harder than the other? What's happening is the level of the transducer overlying these peaks. Let me go back over here to these 2 peaks. Let's see, right about there. These are 2 peaks right here. The examiner has a transducer more or less level over these 2 peaks. On the other hand, as they tilt the transducer more towards this side, the half of the mass that is a little bit more bulgy on that side peaks higher, and the examiner is tilting the transducer in this direction, making this peak higher. As the examiner tilts the transducer slightly in this direction, this peak gets higher than that, when in actuality it's really the examiner who's adjusting their transducer position. It's not the mass that's changing, and that's why it's so valuable to examine a single mass for some time. This is a good length of time to examine a mass. And as we examine, we see that side is a little higher, then they're both about the same, and they remain the same towards the end. Let's look at this one more time. Here the examiner is leaning a little bit more towards the left, now a little bit more towards the right, pushing more on this side of the mass, and as it goes this way, he varies. The examiner is not examining this mass with an even distribution of the transducer on top of the mass. And this is the kind of picture you get. There's nothing wrong with this type of picture. SureTouch will incorporate all that information and get an accumulated image. And what we see with the accumulated image is that there is like a double-peaked mass. There are 2 peaks, and our shape is described below here as multiple peaks. And we can see that through the accumulated image, and we can see the size of it. This gives us a very good example. So it was useful for the examiner to take some time and look at this mass and keep it in the transducer field, not letting it out of the field, But despite the fact that you see one peak and then you see another peak, that is not a bad exam. That just lets you know that the transducer was not exactly level all the time on this mass. But this is a classic example of a very suspicious malignant appearing mass. And with this oblong appearance with a double peak exam, we see that the SureTouch measured it at 22 by 15 millimeters. It was very hard relative to the surrounding tissue, and we could see that as we watched the exam, and it's described as multiple peaks. It was located at 3 o'clock in the right breast. It's useful to look at the system. What was our system as we examined this? This system was on a screening mode at 25, pressures being the highest. Well, we peaked out at that top pressure when we were looking at the most recent exam, and it's calculating at 40% of peak pressure. So let's go back, and actually, I'm sorry, let's go back and put it at 20. What would it look like if we looked at it at 20? And we would expect the peaks to be higher, which they are. They go all the way to the top of the screen. But basically, the image is the same. We're looking at a very hard mass, which shows up on the accumulated image as this picture on the right, just slightly different at 20 kilopascals, but essentially giving us the same information. A very malignant appearing mass in the right breast.
Medical Tactile would like to extend our sincere appreciation to Dr. Carrie Kaufman, the medical director at Bellingham Breast Center in Bellingham, Washington, for his time and participation in this video. You can find out more information about the SureTouch visual mapping system and Medical Tactile Incorporated at our website at www.medicaltactile.com. Thank you.